So Des is like my, she's my go-to girl for everything. But she's also, in a senior management position, as far as the team is concerned in the ER. And there's nothing she doesn't know the answer to. There's nothing she's frightened of. She takes things on with both hands, and she figures out whatever solution to that problem. If we have, let's say, a patient that comes into the emergency department and there's no demographic information on that patient, she does this investigative search to try and find out who they are and where the family is and who can we notify, and she just goes the extra mile every single time. And COVID was really no different, and it was a frightening time for all of us. And I remember one very specific Saturday where I came into the ER and I looked and there was Desiree. And when I realized it was just me and Desiree on the administrative team for the ER, because everybody was either, had worked a double already and went home, or were out sick, and there was nobody left. And it was her and I, and we just split the ER in two. She took one side, I took the other side, and we just ran with it for the next 18 hours. And that's the kind of person you want on your team, because they're not afraid of anything, And, I told the COO during this process, I said, me and Des could rule the world. We what we've done for this COVID outbreak for Jacoby Medical Center, we could rule the world. She is so invaluable. And I couldn't have done that without her. I couldn't have, I'm in charge of all the clinical operations here, but I'm also in charge of emergency preparedness. But she was my go-to girl, because she really does have a handle on the operation, but she also has a sense of calm in tragedy that you don't see in the average individual. And the doctors, the nurses, the chairman, they turn to Des because she is the person there, that's one, going to get it done, but two, going to get it done so well you don't have to think about it again. And a lot of the things that she came up with, her ideas, we utilized for best practices and stuff. And even during that scary time when there needed to be help with the morgue situation, she was like, I'll go, Janice, you and I'll go down and take care of this. I'm like, okay, fine. So we went and did things that, other folks didn't want to do. And, she just, I can't say enough good things about her.
Hello, today's conversation is with Desiree Guzman, the Emergency Department Coordinating Manager at Jacoby Medical Center and one of the Frederick O'Reilly Hayes Award winners for her service during the COVID-19 pandemic response. So just as sort of a refresher, can you tell us a little bit about what normal operations are like for you and what the shift was like going into a crisis response mode and dealing with this pandemic specifically?
But generally, it's never clear cut, especially when you work in the emergency room. It's always either you have your down days and you have your big trauma days. You have 4 or 5 traumas, some cardiac arrests. Those things happen. But during this pandemic and beginning with the pandemic, I think that we're like with everything, you think you can be prepared. And so we try to prepare so that way there won't be no issues or any obstacles coming along. But I think that we didn't know the magnitude of the effect, especially of how fast this came to us. I mean, we went from having 10 COVID patients on one day to having the entire emergency department, including pediatrics, filled with COVID patients. And then they started to get admitted, and some of them started to get really, really sick. And then it was full force from there. And things started to happen, and it was a very learning curve for a lot of people. And all attitudes had to be put aside. You had to work together. We started to realize that even the housekeeper was as important as the doctor that's on call. And everyone started to chip in. And then 42 days later, I did 42 days, 16 hours a shift. I realized the magnitude and how this would have changed and did change everyone's life. For me, I can say that it made me see, not that I didn't have this aspect before, but it made me see life as being very short. And I needed to appreciate exactly what life brings. So then it was very apparent that it was not only the patients that were affected, it was their loved ones. And so what started happening was, due to CDC regulations and the rules that were coming from the government, we weren't allowed to let family members come in and see their loved ones, whether they were passing away or dying or very, very sick. We were not allowed to let them in, for their safety and for the staff safety. So we came up with this iPad program where we would get these iPads and try to have family members that were able to at least verbalize, speak to their loved ones or get to see them.
Right.
But then there was those cases where they couldn't. They were intubated, non-responsive. But for the ones that we could do, we tried. And it became very apparent. Then at the moment, my senior director was in charge of the morgue. So we also had to deal with funeral homes giving families hard times, bodies of patients and loved ones here for months, 2 months, sometimes weeks. And it was just a lot. And we did our best and we learned big, hard lessons. I can tell you that, and I can say that for everyone.
Let me ask you, what transitioning from normal operations to these crisis operations, what would you say were the biggest changes that you had to make? I mean, you've hit one already, right? Which was how do you deal with the human side of patient care, right? How is it you make those connections? I'm assuming you had supply chain issues that you had to deal with.
Absolutely. I would tell you in the corporation, and I think I was told this several times, in the corporation, we probably were better off than a lot of hospitals. But we had moments that we were scared. We were scared that we were going to not have enough supplies for the staff, the nursing staff. We had got a slew of nurses from all over the states that had come to help us with the demand. And not only did we have to supply the staff that were here, but also supply them and make sure they were protected. And it's a lot. And at times, I think senior leadership was very scared, but we did everything we could to try to make sure that everyone had what they had. It was no longer a suit and tie. It was everyone wore scrubs, no matter who it was. Housekeepers were no longer just housekeepers. I mean, you've seen housekeepers pushing vents to help doctors to take vents inside rooms, and respiratory therapists who, I mean, they are important, but the fact and the matter of them being the major component when it came to a lot of these patients that came in, because COVID would take over their respiratory system. And so the importance of them was even highlighted more. So respiratory was a huge, huge component to the saving of a lot of lives. And then we started getting scared that we wouldn't have enough vents or enough respiratory equipment. And we borrowed and they borrowed from us, and we tried our hardest. We had the command center open 24 hours a day. So any issues that came along, we either borrowed or they borrowed from us. So we tried our hardest.
And one other sort of general question, a fair amount of the operations, a fair amount of the evolutions, it sounded to me like you guys had took people out of their scope of practice. Did that cause problems with unions?
With whom? Sorry.
With any of the unions?
Sometimes. So we have some nurses, I know from senior leadership and being in the meetings, some nurses who are med-surg nurses didn't have ICU capabilities. So it took nursing leadership to figure out those nurses that were certified to do ICU capability and reroute those nurses. So that was a huge job for them. And then the ones that needed to be trained were given training. I mean, I'm not sure it was the best training, but it was training.
It was better than no training, right?
Right, exactly. And then we had like pediatrics. Pediatrics was also a huge part for us. when we started to run out of bed capability, peds attendings and the peds specialists began to open their portals. And so we started to put adult patients with certain criterias on their floors. And so pediatric nurses who didn't really know how to deal with adult patients now had to learn.
And that's a big lift, pun intended.
Yeah, that's a little different than dealing with little kids.
Well, and let's drill down a little bit, because this is supposed to be about you. So could you tell me what was one of the major problems or crises that in your role you ran into that you had to address while you were living through the heat of battle?
So I think the biggest thing that I was fearful was that the staff didn't know that we had every intention to be there for them. And I'm not a physician, and I'm not a nurse, and I'm not a respiratory therapist, and I don't pretend to be a trauma doctor or anesthesiologist, but I wanted them to know that along with myself and the rest of the management team, we had their back. So anything we could have done, we did. Whether it was get them lunch if we needed to, push the vents ourselves, talk to patients sometimes, translate for the patients that didn't speak Spanish, or we also have Albanian nurses. We would do that. And we just tried our hardest to make sure that we were there for them. There were times they would ask me for meds or ask me for some type of equipment. And, you know, I've always kept my eyes open past my scope to know what's going on the floor. So a lot of the things they would ask before I knew where they were at. So I would assist them with that. And then we had our regular traumas. And, you know, Desiree, get me a chest tube. And I would run, and you'll see me do that and help them out and build commodes for people that we couldn't get out of the room. So there was a lot of things that I would never done prior. That was open season for me. And then the Army came. And with the deceased, there was this huge naval yard they had opened to hold the deceased until bodies could have been claimed. And it was held in Brooklyn Naval Yard. I was told to kind of assist the Army in ensuring that we had the right patients. And so we had to rebag and re-tag bodies. And I've dealt with death, but I've never dealt with it in that scope.
Yeah.
So that right there changed my perspective of life also. It made me more broad in my job, and there's nothing I wouldn't do for anything or anybody in here. So that's basically, and when I say not only myself, there was a huge team behind me. We have a total, I think, of 8 managers, and out of 8, 6 of them got sick. So it was only me and my senior associate director who didn't get sick until the end. And we had to hold down the fort. So it was challenging, but a huge experience.
So, and let me ask you, we talked a little bit before, you said your undergraduate's in criminal justice. What sort of skills do you think that you brought to your job that allowed you to perform the way you did during this pandemic?
I'm going to be honest with you. It's not only my degree. In my previous younger life, I went through some personal stuff, and it's hence the reason why I wanted to become an officer. I wanted to be a police officer. I actually wanted to be a homicide detective. I had seen a lot of things in my younger years that weren't so nice. And so that's where I wanted to be. But personally, I had a medical condition that didn't allow me to do that. And then at the age of 21, I got a job at Jacoby, and I've been here since, with the notion of getting better and going into some type of law enforcement. But now I'm old, so it ain't working.
Well, and let me ask you this, because I mean, it's much like you. I had a life before I was a college professor. And I actually became a professor because I had a lot of questions about the things that I saw in real life. And I think there are those things that you can be taught, and there are those things that you learn. And
Absolutely.
often while we try to duplicate some of the latter and higher education, it doesn't have the same impact. You know, it sounds to me like you have a lot of innate understanding of groups and group dynamics and the way people respond, especially with you saying to me that the thing that you did that was most important is you made sure you looked out for the least empowered amongst the staff. And I think that that's probably always the right answer in a hospital, right? You never really have to worry about your docs and normal operations. It's always about the person who has to make sure the doc has something, whether that's clean scrubs or a clean space to work in, those folks who don't get that recognition. And I think that was insightful on your part, quite frankly. And now, if you had to say to yourself, after what I've lived through in this job, let me ask you, are there things that you see that your job should have as skill sets? And are there other skill sets that you think that you would like to have to be more effectual in what you're doing?
So, you know, when I started as a clerical associate, and I wanted to be an officer at one point. But in the middle of me being here so many years, I always thought about being a nurse. And that's because I was around nurses. And I respect their job. I also respect physicians and everybody else. But for nursing, it was something that I wanted to do. It never happened, but during this pandemic, after the pandemic was done, I literally thought about it. And I said, maybe I should just become a nurse, because I was doing things out of my scope. I wasn't the only one, but we did things to work together to try to make things work. And so I wish I had that medical background, so that way the exhausted nurse that was in the room for 11 hours because she couldn't leave because she was exposed, I could have given her a break. Same thing for, the radiologists that would go in and take x-rays of their chest. And there was a lot of things. I just wished I had a medical background. So with that being said, I believe my senior director also felt the same way. And she now, we take classes for certain things, emergency management, which we were doing before, but I think she's more apparent with it now. That way we can help more in any other case. God forbid we go through this again.
Hey, what sort of, do you take classes in emergency management? Are you talking like ICS 100, 200, 700, 800, that sort of thing? Or
yeah, like mass casualties, casualty. We had shooter response drills, and I think we have one coming up in September. Things like that, because along with COVID, we were dealing with trauma cases. So that was the hard part. At one point in the beginning of the pandemic, they were, people who had medical issues, nursing home patients, patients with asthma problems, heart problems that were getting these cases. But then we started to get trauma patients that were gunshot wounds and stab wounds and car accidents. And then, we were mandated to swab and test everyone. And we started to realize that a lot of those patients were coming in positive and with COVID, with no symptoms of what we were told were the symptoms for COVID. So it was a lot of transitioning and just learning how to adapt with whatever environment daily was presented to us.
So let me ask you, are there things, when you think about the organization and you think about the design of the organization and the way the organization operates, are there things now that you think should be changed in the way business is done with your organization that came about as a result of working through the pandemic there?
I think that what we didn't pay attention to, because we were more on a walking through the fire, was the importance of social work, the importance of their role. This was the human dynamic. And you started to realize that the need of social workers was as important as ever. And there was such a shortage of social workers that we had at the moment. The human dynamic, what happens when you go home after dealing with this, after being in a hospital for a month and not being able to speak to your family members, or going home and finding out that you were fighting it and you went home and now 2 of your family members are gone. And so there is a huge impact mentally that I think that is a residual effect. And I think that psychiatric emergency is another thing. We had patients that were coming in with real anxiety, worry. I had a little girl, I say a little girl because she was younger than me, she was 22. She lost both of her parents the same day and had no one else. She was not even from here. And she, was raised here, but that's all she had was her parents. So what happens with her when she goes home?
Yeah.
And she realizes mommy and daddy ain't there. Or the little 13-year-old that's intubated and never wakes up. Like, I feel like that compassion needs to come back into healthcare in a big way. And, it's proven. There's people that are battling cancer. There's people that are battling AIDS. There are people who are battling life-threatening illnesses. And all they ask for is, I want my wife next to me. I want my husband next to me. I want my child next to me. That's all they really want, is that compassion while they fight whatever diseases they're going through. So I think that if we're going to change anything, is our compassion towards our patients and ourselves. Because there was times that, this is our job. My job is to manage. Nurse's job is to be a nurse. Doctor's job is to be a doctor. Respiratory to be respiratory. But they're also human. They also were scared. They had to go back to their families and their children. I know for me, my two kids, I separated them. I didn't see them for 3 months. Just so that way I would never expose them. My mom, who has heart problems, I didn't see her for 3 months because I did not want to expose her either. So I stood in a hotel and FaceTimed all day when I had a chance. And that was my relationship with my children for 3 months. And it affected me. I'm glad I have them, but how about the people that don't have them? Yeah. And that's where we have to go. And I think that if everyone leads with compassion with whatever they do, it makes a huge difference.
That seems like a fantastic place to end the sort of formal part about this. Let me ask you, though, what sort of things, as we've been talking about this, have run through your mind that I haven't been smart enough to ask you about?
I'm not sure. The other component that I think that we've lost, I think that I've always had a respect on every aspect of healthcare. Everyone who's involved, whether it's the housekeeper or the EMS or the paramedic. We didn't take into account, the police officers that had to deal with this, the EMS that came in and out and were exposed themselves. So I think that I started to have a huge respect for everyone when it came to understanding that everybody's role is important. No one is as important as the other. Everyone, without me, they won't be them. Without them, it won't be me. I always say there's not an I in team. And I believe that wholeheartedly. So I just grown a huge respect for everyone's duty.
Well, that's good. I can't thank you enough for your time.
Anytime. I apologize for being so late. I'm so sorry.
It happens. I can't thank you enough for your service. It's nice that one John Jay has alums that are out doing God's work. And it's nice that you are willing to give back a little bit. And we certainly do appreciate that. And I know that both the faculty and the students are going to benefit an awful lot from your participation in this.
Definitely. I mean, any questions, I'm here. I have a staff behind me. Thanks you so much.
Thanks again for your time, Desiree.
Thank you.